Hi everybody, Eric Wilson with ISO Health Incorporated. Hope you're having a fantastic day. Wanted to talk to you about what's become my favorite topic, Obamacare, and policies. As you see, many policies are being canceled. I told you on the last video that my policy with Blue Cross Blue Shield is also being canceled. Well, if you saw we'll call it the campaign of our president here the other day, he said, you know, your plans are substandard, that's why they're being canceled. They talk about the 10 essential benefits that all their plans have to have, and that makes them better. Well, first of all, my current plan had a 5,200 family deductible. The new plan that I'm being offered by Blue Cross is 12,700 deductible for what they call comparable plan. Now the president says shop around, but they're all kind of cookie cut, so I could pay more money, yes, and get a better plan. I'm already going to pay $100 more per month or $200 more a month than I'm currently paying. Nonetheless, these are the 10 essential benefits I want to talk about. Ambulatory patient services. My current plan already had that, so remember my substandard plan that's being canceled had that. Emergency services, my substandard plan had that. Hospitalization, yes, my policy had that as well. Maternity and newborn care, no, my plan did not have that. I no longer need that benefit. At one point I did have that benefit. I do no longer do. Mental health and substance use disorder, including behavioral health treatment. I think my plan had that one. I don't need that one, however. At least not now. I guess if you ask my wife, maybe I do. Prescription drugs. Yes, my policy covers prescription drugs. Rehabilitative and habilitative services and devices. Yes, my substandard policy that I currently have is that too. You carry a major medical plan. That's what major medical stands for. Laboratory services. My policy had that. Preventive and wellness services and chronic disease management. Yes, I had that because I got the plan. My grandfather plan I had to cancel because the price got too high, so I went to a new plan. The new plan at that point had those services. Pediatric services, including oral and vision care. My plan had pediatric services. It did not have oral and vision care with it. I had that separately. I did have it, just not through my major medical plan. So I'm not sure how my plan is substandard. Also, it was said that the reason I had to make these changes is people become bankrupt due to medical bills. Medical bankruptcy is a problem in this country. However, it is not solely because you're higher out of pocket and higher deductibles. Oftentimes people have some debt already, and the medical bills contribute to them. Also, if you're like me, I'm self-employed. Okay, if I don't work, I don't get paid. Well, if I have a heart attack, stroke, or cancer, something along those lines, yes, my medical insurance is going to pay it fine. We're okay with that. I mean, I still have a deductible on my previous plan, $5,200 deductible. I'm not sure what I'm going to do on my new plan yet because I don't think I'm going to do the 12,700 because that just seems crazy. At the same time, I don't want to pay $700 a month for insurance. However, if I'm not going to work, I'm not generating any income. Therefore, that's part of the reason why people have to file medical bankruptcy, is because it's not just the combination of the deductible and the copays, it's the lack of income that you are generating. Now, I think if I go to this new plan that I've been offered with a $12,700 out-of-pocket maximum, I think I'm more likely to have to file bankruptcy than my $5,200 plan. That's just simple mathematics. Now, what you can also do, you can wrap around a nice accident plan or a critical illness plan around these plans that oftentimes for 40 or 50 bucks a month, 30 bucks a month, something like that, that will pay you $10,000 or $20,000 if you have one of those critical illnesses. So I think you need to be smart when you do your new plan, whether you do it through an Affordable Care Act plan. If you have something outside the product, look at a higher deductible and maybe a supplemental plan to wrap around it, because that's what will protect you from medical bankruptcy, not the high deductible, not the new health care plan, not the preventative care. The preventative stuff is all nice. Insurance should be for things that you cannot pay for. We'll keep it in those perspectives. I can pay $100 for a physical. I don't want to, but I can. I can pay $125 for a doctor visit. I can. What I can't pay is $12,700 out of my pocket if I have a major illness. So either way, there's my tip of the day. Thank you for listening. Eric Wilson. More information on my blog at www.isohealth.com. Have a great day.